Good morning, everyone, and welcome to this virtual media briefing to inform you, the media, and by extension, Caribbean people about the COVAX facility. CARPHA is pleased to partner with the European Union and the Pan American Health Organization to ensure that our CARPHA member states have equitable access to a safe COVID-19 vaccine when it becomes available. I am Carlin Curtin, Communications Manager at CARPHA, and as chair of this morning's proceedings, I would like to take the opportunity to warmly welcome and introduce you to our esteemed panelists. Dr. Joy St. John, Executive Director, CARPHA; Mr. Luis Maia, Head of Cooperation, the European Union, Barbados; Dr. Jarbas Barbosa da Silva, Assistant Director, Pan American Health Organization. Ladies and gentlemen of the media, before I invite our first speaker to address you, I would like to take the opportunity to advise that you may place any questions that you may have into the Q&A feature that you will see under, if you click on More at the bottom of your screen. I urge you to ask questions that are related to the COVAX COVID-19 vaccine facility. You are free to post those questions at any time during the briefing. Your questions will be answered by technical advisors directly into the Q&A or by our panelists during the question and answer segment at the end of the presentations. It is now my pleasure to invite my Executive Director of CARPHA, Dr. Joy St. John, to deliver opening remarks. Over to you, Dr. St. John.
Thank you very much, Ms. Curtin, and good morning to everyone. I am incredibly happy this morning because I am very pleased to announce that CARPHA has been able to assist several of our member states with the down payment to the COVAX facility to allow them access to the COVID-19 vaccine, which will be developed after the safe and thorough clinical trials of the COVAX facility. CARPHA has been able to do this through the kind cooperation of two of our very best partners, the Pan American Health Organization and the European Union. CARPHA has an agreement with the European Union which allows for a pot of money to be given for use of purchase of vaccines and treatments. And we were very happy when we learned of the ways in which the COVAX facility was being facilitated by the Pan American Health Organization for the region of the Americas, of which CARICOM is a sub-region. And so after much discussion and consideration and the involvement and agreement of the member states, we have come to this point where we have been able to transfer monies from the pot of money from the European Union to the Pan American Health Organization for onward transmission to Gavi for use as a down payment. I am pleased because we are helping our member states in what is the mother of all crises that has struck the world in an unprecedented manner. And I'm also happy because there has been a collaboration between the EU across the pond and Pan American Health Organization in this pond with CARPHA and representing the whole of the Americas. I think it's a fabulous achievement. And the other part of the fabulous achievement, which our two guests will speak on more, is the record time in which we were able to get this resolved, come to a legal agreement, and transfer the funds. So I am so pleased to tell you of the particular amount which has been transferred. There has been the transfer of US $2,028,233, which represents approximately 1.8 million euros. coming from the pot of money of 3 million euros in the grant. And we have been able to support Antigua, Barbados, BVI, Cayman Islands, Jamaica, and Turks and Caicos Islands with 100% of the down payment required for the COVAX facility. We have been able to support Suriname with 18% of the down payment required for the COVAX facility. And these will cover just about 20% of the population in total. We were very pleased to be able to do this transfer of money at this time so that we know that our member states are guaranteed access when the final vaccines, which have been tested and found safe and efficacious, are available. I am so pleased today. And I want to acknowledge not only our partnership, but also the work of the CARPHA staff, along with our partners in getting this achieved. So, Madam Chair, I hand this over to you so that our guests can speak on their part of this marvelous collaboration. Thank you.
Thank you, Dr. St. John. A gentle reminder that you may post any questions related to what has been said into the Q&A feature that you will see at the bottom of your device if you click on More. I now have the privilege of inviting Mr. Luis Maia, Head of Cooperation at the European Union, to address you on the grant agreement signed with CARPHA for the purchase of COVID-19 vaccines for the benefit of Caribbean territories. Mr. Maia.
Good morning to you all. I would like to start by greeting Dr. Joy St. John, Executive Director of CARPHA, and thank her so much for the very nice words. O Dr. Jarbas Barbosa da Silva, Assistente do Diretor da Organização Pan-Americana de Saúde, Ms. Carlton Curtin, Communications Manager of CARPHA, and of course, all the media representatives. It is a great pleasure for me, it is also for me a great pleasure to join you in this morning to participate in this briefing on the EU, CARPHA and PAO collaboration to support the participation of countries in the region to the COVAX facility. Developing and having access to safe and effective vaccines against COVID-19 constitutes one of the most pressing challenges of our time. COVID-19 has caused a pandemic that undermines all sustainable development goals. And for this reason, the EU solidarity must prevail to stop the transmission worldwide. As you may know, the COVAX facility is a global initiative that brings together governments, manufacturers, and other stakeholders to ensure that future effective and safe COVID-19 vaccines will reach those in greatest needed, wherever they are and wherever they live. To date, more than 150 countries participate in COVAX facility, launched in June 2020. COVAX is one of the pillars of the Access to COVID-19 Tools Accelerator, a groundbreaking framework for collaboration that brings together governments, health organizations, scientists, businesses, civil society, and philanthropists to speed up efforts to end the pandemic by supporting the developments and equitable distribution of the vaccines, diagnostics, and treatments the world needs while strengthening health systems. The European Commission President Ursula von der Leyen hosted the Coronavirus Global Response Pledging Conference in May 2020 to support the objectives of the Access to COVID-19 Tools Accelerator. More recently, on 31st of August, the European Union announced its support to COVAX, starting with 400 million euros in guarantees. The European Union recognizes that no one will be safe until everyone is safe, and it is committed to ensuring that everyone everyone who needs a vaccine gets it anywhere in the world. And together with our global efforts, the EU is committed to this region. You may recall that in April 2020, the European Union and CARPHA signed a grant contract valued at 8 million euros. And the agreement was aimed at health security strengthening for prevention and control of outbreaks of communicable diseases in the Caribbean. This grant was conceived from the very beginning to support the region in its efforts to be prepared and fight the pandemic. In concrete terms, the grant is covering the purchase of masks and other personal protective equipment, reagents and other materials required for coronavirus testing, and in addition, 3 additional laboratory technologists have been recruited to deal with the surge in demand for testing for the COVID-19 virus. Further, the grantor is also strengthening quarantine and isolation procedures and promoting guidelines and protocols among health professionals. Additionally, the grant increasing surveillance at ports of entry, as well as setting up robust systems for contact tracing. I'm pleased to say that after 6 months from signature of this grant, substantial actions have been carried out towards achieving the intended objectives. Finally, thinking about the near future, significant funds were set aside to finance treatment and vaccines when they became available. Therefore, as Dr. St. John mentioned, this is a significant moment for us, as 2 million or more than 2 million of US dollars from this EU-funded grant have just been transferred to the COVAX facility. And this translates into an upfront payment for more than 1 million doses of a successful vaccine for CARPHA member states when the vaccine is available. This should contribute to moving the countries in the region into a position where the virus no longer negatively affects the health system, the economy, or the everyday life of its citizens. CARPHA and PAU are to be commended on their extraordinary efforts during last weeks for ensuring that countries in the region were aware of this opportunity and able to access the facility. I would say that it has been an exceptional collaboration and a genuine partnership between the 3 organizations. And let me take this opportunity to also thank the teams of CARPHA, PAO, and my colleagues in the EU delegations who made this possible. Thank you very much for your attention.
Thank you, Mr. Maia. Again, please post questions that you may have in the Q&A feature at the bottom of your device when you click More. They will be answered after the formal presentations, and some of them may in fact be answered during the presentations. At this time, I am pleased to invite Dr. Jarbas Barbosa da Silva, Assistant Director, Pan American Health Organization, to advise on their role in member states' ability to access the much anticipated vaccine. Dr. Barbosa.
Thank you, Carlo. Good morning. First, I want to thank Dr. Joy St. John, Executive Director of CARPHA, and her team that worked very well and in a very committed way to make this agreement happen. I also want to thank Mr. Luis Maia, who is the head of the European Union collaboration in the Caribbean region. I think that this was indeed a very good example of collaboration, a very positive and constructive collaboration among the 3 institutions in order to provide this very important goal to increase the equitable access to vaccines to the Caribbean countries. The Caribbean countries have been very importantly affected by the COVID-19 because they are very dependent on tourism. Their economies depend a lot on tourism, so they have been hit very hard during these recent months, and this is a very important initiative to guarantee that they will have access to the vaccine. Since the start of the COVID-19 pandemic, countries in the region of the Americas have reported more than 18 million cases and almost 600,000 deaths. In the 20 CARICOM countries, there are over 40,000 reported cases and 864 deaths. Global equitable access to a vaccine and one that protects healthcare workers, frontline workers, and those most at risk is the best way to mitigate the public health and economic impact of the pandemic. There have been a number of important developments in the search for a COVID-19 vaccine. Now we have nearly 200 vaccine candidates that are being studied, and the global health community is working diligently in the hopes that one or more of these will prove to be safe and effective. We do not yet know which vaccine will be found safe and effective and how it will work. But we do know that if we don't prepare now, we will miss the opportunity to benefit from it quickly. There are currently 10 vaccines in phase 3 of clinical trials. That's the final stage of clinical trials. 40 countries and territories in the Americas are joining the COVAX Facility. 30 of these countries and territories are considered self-financing countries, and 10 will receive support through COVAX AMC. They are eligible countries to receive the support, the financial support from the facility. These countries, these 40 countries, engaging with COVAX, they will have access for equitable access to the future COVID-19 vaccines, including 13 countries and territories in the Caribbean. 7 are self-financing and 6 are COVAX AMC eligible. I would like to take this opportunity to congratulate the self-sustaining countries for signing commitment agreements recently to the COVAX facility. PAHO remains committed to support our member states in all aspects of their preparedness for the introduction of the future COVID-19 vaccine, and in the strengthening of the national immunization programs overall. On behalf of our regional director, Dr. Carissa Etienne, PAHO is especially pleased to be a part of this collaboration with the European Union and CARPHA. Through this agreement, just described by CARPHA and the European Union, PAHO will facilitate the transfer of the funds from CARPHA to Gavi for the initial down payment against their commitment agreements. When the new vaccine or vaccines become available, our member states will be able to purchase them through the PAHO revolving fund, leveraging the established process in place and its 40 years of experience in the region. The Caribbean has been a leader in immunization and primary health care in this region and globally. The COVID-19 pandemic threatens many of these hard-earned gains. Strengthening routine coverage rates for all vaccines in use, strengthening surveillance for vaccine-preventable diseases, and preparing for the successful introduction of COVID-19 vaccine requires all our collective efforts. Thank you, CARPHA and European Union, to be joined in this very important effort to guarantee equitable access. Thank you.
Thank you, Dr. Barbosa. We are now at our question and answer segment. Thank you to those who have posted questions, some of which we have already responded to. I would like to invite Dr. St. John, Executive Director of CARPHA, to respond to our first question from, let's see, Marlon Madden. It says, can CARPHA say at this time what the process will be for member states to get the vaccine when it becomes available? And what recommendations are there for the process in people accessing it? Dr. St. John, would you respond to this for us, please?
I'll start the answer by saying that Dr. Barbosa just did a very good explanation of how countries can access. But I'll just start the answer by saying that the COVAX facility allowed for countries to guarantee access by putting down a down payment, which is what CARPHA has supported countries with. After that, there is a process which I would prefer that Paho answers. If you don't mind, Dr. Barbosa, repeating what you just said for the benefit of those who may have missed it while they were typing their questions.
Okay, thank you, Joy. Just to clarify for the journalists that are not used to this new mechanism that is COVAX. COVAX is a global mechanism that was established by WHO and many other partners and international institutions such as Gavi, CEPI, and the main objective of COVAX is to guarantee equitable access. Now, we have 180 countries that have joined COVAX Facility. We have 92 countries among these 180 that are considered eligible to receive support from the AMC. These countries are countries that have low, that are low-income countries, and or they are considered small markets. In our region, in the Americas, we have 10 countries that are eligible to receive the vaccines through this mechanism. These are the following countries. Just a moment. In the region of the Americas, we have Bolivia, we have Dominica, we have El Salvador, we have Grenada, we have Guyana, Haiti, Honduras, Nicaragua, St. Lucia, St. Vincent, and the Grenadines. These 10 countries, if COVAX receive all the donations and grants that are expected, we receive the vaccine free of charge. These are 10 countries. The other 30 countries in our region and territories, they are considered self-financing countries. What does that mean? They need to make a payment now, this down payment, in order to allow COVAX to make agreements with all the producers that are already in the final phase of clinical trials. This is the most important thing about COVAX. COVAX is not making bilateral agreements with one or two producers. This is a basket of producers, so the risk of that one vaccine will not perform well will be totally, almost totally avoided, because you have this basket of producers. So the countries now are making this down payment in order to allow COVAX to make this commitment on behalf of the countries. And when the vaccine is available, we will have the PAHO revolving fund and UNICEF as the purchasing mechanism to purchase the vaccines on behalf of the country. So with this down payment that is being made now, with this collaborative effort from CARPHA, the European Union, the countries are ready to finalize the first phase of the engagement, and now we'll have to wait until the vaccine is available. We don't know yet when, maybe in the beginning of 2021, but these countries will have their engagement totally committed. Thank you.
Thank you, Dr.
If you will permit me, I just wanted to add that CARPHA had done a calculation of the way in which we could apportion the pot of funds to 3 million euros. And so even though other countries may have made arrangements for loans to pay down the down payment, we still do have funds to support them with treatments in the future. So we're also making sure that if any of the countries who are down on the list to get them free need any support of any kind, that we do have funds to support them as well. So just letting you know that this is a backup for even those countries that may get it free if there's any small percentage that they have to pay.
Thank you, Drs. Barbosa and Dr. St. John. Question from Rena Pear, I believe. How much money do the countries have to pay down to gain access? Dr. St. John, I invite you to take this question as well.
And again, I want to share this with Dr. Barbosa. There was a sum of money calculated for what the vaccine is likely to cost. And then the down payment would have reflected the percentage of the population that the government has decided to cover with the vaccine. So the sum of money per dose, I think, is around $10 US. Dr. Barbosa or Dr. Broom could correct me where that is concerned. And so CARPHA has supported the countries with about 15 to 20% of their population being immunized, and with a portion of that $10. So each country had its own calculation. This has been a very precise process. And it is a good thing that I have a director of corporate services whose head can take in all of these calculations. But after discussion with PAHO, we would have been advised on the amount of money that we would need to put forward. So maybe Dr. Barbosa, possibly supported by Dr. Broom, can fill in the blanks on that answer.
Oh, thank you. Dr. St. John, just to complement, you are correct. We probably will not have a vaccine in a volume that we will be able to vaccinate 100% of the population. So what are the criteria that we can use? The main objective of COVAX is to have around a volume of doses that correspond to 20% of the population. And why 20%? Because probably within this 20%, we have all the healthcare workers and other frontline workers. This corresponds to around the 3% of the population. And the other 17% are people with 60 years and more, other adults with underlying conditions, such as hypertension, cardiovascular diseases, diabetes, cancer, and other conditions that can be a risk factor to develop a severe case of COVID-19. So the main objective is to guarantee that every country will receive the vaccines to protect this first 20% of their population. Of course, that each country will have some flexibility and they will adopt their own national strategy. For example, in the Caribbean countries, maybe to protect also the tourism sector workers will be a priority in order to protect the economy of this country. So, but to have a rough estimation for every country in the world, we are using this 20% of the population. For this 20%, most of these 10 vaccines that are already in the final phase, they will require 2 doses. So if you take this number around the $10, $11 per dose, this is an average. We don't know what will be the real cost of the vaccine, because we have a vaccine that is estimated to cost $2.5 each dose, but we have also vaccines that are estimating that the cost will be $30, $35. So $10, $11 is an estimation. So the countries now are paying around 15% of this 20% volume that they will have access. And when the vaccine is available, we will know the real price of the vaccine, and the countries will pay for the rest. But we are still discussing with many financial institutions in the Caribbean, in the region, and worldwide in order to get more support to the countries, because we do know that some countries in the region, they were affected very, very hard by the pandemic. I already mentioned the countries that rely on tourism, countries that rely on exportation. So I think that our task is not already accomplished. We still work together with CARPHA, with European Union and many other partners in order to get more support to the countries in the region of the Americas and in the Caribbean.
Thank you, Drs. St. John and Barbosa. Question from Marlon Madden. Are there yet any recommendations for the process for people to access the vaccine, or will this be left entirely up to the countries? Will there be an independent body that will ensure equitable distribution? Who would like to take that question? Dr. St. John?
That sounds like 6 questions in one, but let me start. And then
I agree.
I will beg
the first one?
I will beg my colleagues at PAHO to save me.
I can break it down for you.
No.
Okay.
I know what he's getting at, so I'm trying to deal with some of it. Okay,
Good,
so
thank you.
the first thing that we need to let you know in terms of the proportioning of the 3 million euros that we were given by the EU. CARPHA used a formula which involved the understanding of the non-communicable disease burden in each country, the burden of risk factors like obesity and smoking, the prevalence of, let me put it this way, the ability of countries to detect background disease other than by taking a COVID positive. So for example, there are countries that monitor severe acute respiratory infections. And so we looked at those numbers to see where there was a burden, a high burden in countries. We also would have taken into account the proportion of the population by age group, because you know that older persons are more affected. So in the apportioning of the money to our 26 member states, we used that kind of equitable formula. Now, your next layer is this whole issue of who should get access among the population. Who are the more vulnerable? And I think that I would prefer that PAHO, as they have the immunization program, the expanded program on immunization, should give some guide on what is being advised. But I will say that in listening to what the heads of government have been saying, they have also been looking at things like those who are at risk because of their job or profession. For example, the healthcare workers. Some have even spoken about tourism workers. So there are medical, political, and of course there's always a national overlay, but I would really prefer that PAHO now continues this answer to get at some of the other layers in this question.
Thank you, Dr. St. John. We are already starting the discussion about the strategy that we will recommend. You know that the WHO has a global advisory group. It's called SAGE, Strategic Advisory Group. on immunization. This group has already started the discussion. At the regional level, we have a technical advisory group on vaccines that is chaired by a very well-known scientist and professor from the Caribbean, Dr. Peter Figueroa. We have already started the discussion within the TAG. You know that the strategy, it depends also on the availability of vaccine. If we have vaccine to vaccinate 50% of a population or 10% of a population, it also depends on some characteristics of the vaccine. Some vaccines may be better to be used for people with 60 years and more. Other vaccines can require 2 doses, others 1 dose. So we need to know better about the vaccination. But in general terms, I think that Dr. St. John has explained very clearly what are the main technical criteria that we are using. The first people to be protected should be that people that are in a higher risk to develop a severe disease and to die by COVID-19. So these vulnerable groups are very well known. People with 60 years and more, 65 years and more, people that have underlying conditions, diabetes, hypertension, cancer, and other chronic diseases, asthma, and others. So, of course, that these recommendations need to be adapted for some national context. In some countries in South America, in the Amazon basin, indigenous people are very, very vulnerable to develop severe cases. So these general recommendations, based on the science, that the scientific information that we have so far, and also on the availability of the vaccine. So coming back to that example, if you have only 3% of, if you have only vaccines that will cover 3% of the population, the priority will be the health professionals, healthcare workers, and frontline workers, because they are the most vulnerable. If you have to cover 20% of the population, that is the main goal. Besides them, we will recommend to cover the people that are in a higher risk. If you have to cover 40 or 50%, each country will add in the most vulnerable groups that they have in order to protect the health of the population, in order to keep the main economic sectors running. So each country will adapt the population. But the priority is, 1, healthcare workers and frontline workers. 2, people that have a higher risk to develop severe case and to die of COVID-19.
And if I can just add, just to support what Dr. Barbosa is saying, there is a WHO SAGE values framework for the allocation and prioritization of COVID-19 vaccine. And this is a values framework, and it offers guidance globally on the allocation of COVID-19 vaccine. So it's really guidance to countries. And this document was put out by WHO SAGE, and it is available for persons to reference.
What is SAGE?
Dr. Barbosa actually said it is a strategic advisory group on immunization, and it advises WHO on all immunization matters.
Thank you, Drs. St. John, Barbosa, and Dr. Karen Broom, also of PAHO, for your information. I know that some of you may not have known who is speaking, but that was Dr. Karen Broom of PAHO. Thank you so much for that intervention. I believe, Tracy Gilbert, I believe your question has been answered. Will the 1 million doses be prioritized to those with comorbidities and the aged? I do believe that was covered in the responses that were previously given. Another question by Tracy Gilbert: to achieve herd immunity, 65% of the population need to be vaccinated. So after vulnerable groups, the regular population has to be vaccinated based on the calculation on comorbidities and age. The question here now is, will there be enough doses for population-based immunity? Who's going to take that one?
I can provide an initial answer.
Thank you.
We really don't know for sure if the threshold to ensure herd immunity is 65%. First. Second, we don't know for sure also what if the immunity provided by the vaccines or by the natural infection will last for 1 year, 2 years, 10 years. So I think that is too early to establish a strategy aiming to get the herd immunity. I think that the main objective, at least for 2021, is to protect the most vulnerable groups, to save their lives. Let's remember that how many deaths we have had so far. So the first priority will be to achieve this kind of objective with the vaccine, to protect and save lives. When we have more information about how the vaccines will work, because sometimes we will talk about the vaccine and some people can get the wrong impression that all the vaccines will perform the same, and it is not true. Maybe we will have a vaccine with 60% of efficacy, another one with 80, another one with 55, one that will require 2 doses and 1 boost after 1 year. So I think that is too early to have a strategy to eliminate the transmission completely. I think that the priority again is to protect the most vulnerable groups, the healthcare workers, and to save lives.
And I just wanted to come in here with a little perspective. And it's following on the last point that Dr. Barbosa made. This is really early, even in comparison to other pandemics. For the world to get its act together, do the necessary scientific study, and develop a vaccine. We are in very early stages. And so a lot of the questions that we could normally answer, because we are accustomed to dealing with vaccines for childhood diseases, for tetanus, we can't answer about this vaccine. And so we are doing the best we can as fast as we can. And that also includes the manufacturers of vaccines. This is a totally new vaccine, and they are coming up to speed with what they can produce. A new manufacturing capability is also being looked at and reviewed by WHO. So we don't have everything for everybody at this stage. And that is why I'm glad that there is a tool carefully designed by SAGE, which can support countries in their decision-making.
Thank you so much for those responses. The million-dollar question, Rena Pear is asking, how close are we to have this vaccine?
That's for you.
Yes, unfortunately, thank you for the question. Unfortunately, we don't have a date yet, because as you can see, the vaccines, they need to perform a lot of steps before being considered as meeting the standards for safety and efficacy. So the vaccines we have 10 that are in this final stage, the clinical trial, phase 3. Some, at least 2 of these vaccines, they had to pause the clinical trial to review the data, to see if one event that happened to a person was related or not related to the vaccine. So this is also a good information to see how seriously they are taking these studies. When they finalize these studies, they will need to present a dossier to the health regulatory authorities here in the US, to FDA, if they are produced in Europe, to the European Medicine Agency, EMA, and also the pre-qualification team in Geneva will need to review this dossier. So in a realistic estimation, we are talking about the first semester of 2021, probably between March and June, but we are not able to see exactly the date that the vaccine will be available. So we need to keep all the recommendations to wear a mask, to wash your hands, to keep physical distancing, because we don't have a vaccine yet. We cannot promise that this will be available in 1 month.
We appreciate your response, Dr. Barbosa. Thank you so much for that. From Paul, is that Paula Lindo? Would it be possible to get a list of countries that have been assisted with the down payment with the 1.8 million euros, a list of the self-financing and non-self-financing countries in the Caribbean? Would that be possible for us to provide?
CARPHA can provide a list of countries that we gave the down payment to, but we would need that other information from PAHO. I cannot answer that one, and I am not sure if Dr. Barbosa would like to respond to that one.
I don't have the full list right now, because we know that we had to deal with many administrative details and legal details, and I want to acknowledge that also the team and the legal administrative team in CARPHA and European Union and PAHO, they worked very well together. But for sure that we can send the list and you can share with the journalists, because there is a difference between each country. I don't know if any colleague from CARPHA has this information, or Jesse, or I don't know. But I'll need to go try to find the list.
So what we can do is make an undertaking to discuss with PAHO, and what can be made public, we will make public.
Thank you for that. Marlon Madden asks, with some member countries being a little bigger, like Jamaica, or in the case of the Eastern Caribbean, Barbados, and given the number of people in the tourism and health sectors, isn't 20% of the population but a drop in the bucket? Is it then that governments are expected to come up with funding on its own in time for the vaccine when it becomes available?
So I can start that one. 20% is 20%, even though it may be a drop in the bucket. So once a down payment has been made through the donation from CARPHA or through a loan from elsewhere, there also would have been the need to guarantee funding for the full amount when the vaccine is available. So every country that has made a down payment has also made arrangements for full payment.
Yeah, just to complement, I fully agree with Dr. St. John. It's not a drop, it's 20%. And let's think that this 20%, it's not due to financial limitation. It's because the production capacity is limited. Maybe the world will be lucky and we will have 5 or 10 vaccines at the same time. So probably we can move from 20 to 50% in 1 month or 2 months. But now we are being realistic. that if we achieve to have 2 billion doses 2021, we are talking about a very huge capacity, production capacity. We will be able to cover 20%. And it is not any 20%. Let's remember also that most cases of COVID-19 are mild and moderate. People that are in higher risk to develop severe case and to die will be covered by 20%. So I disagree that is a drop. Frankly, I think that this will be a huge public health achievement if we can get the most vulnerable population protected by in the first semester of next year.
Thank you very much. We are coming close to our wrap-up time as we approach the 11 o'clock hour. Let me see. I did see another question. Maybe it was in fact answered. However, I want to let you all know that the recording will be available right after the media conference on the CARPHA YouTube channel. CARPHA Campus is our YouTube channel, so you will be able to access the recording immediately after, or a few minutes after, the media conference. If there are no more questions at this time, and some of the questions may have been pertinent to a particular member state, I encourage you to raise those questions with your Ministry of Health. We have tried our best to answer all of the questions that you have responded that are related to the COVAX facility and that are regional in nature. I would like to bring this meeting to a close now. So we have come to the end of the media briefing. If we were unable to answer, or if you have any other questions that you would like to have answered, please email us at CARPHA. Please email us at postmaster@carpha.org. I want to assure you that we will make the greatest of efforts to respond to you in a timely manner. And with that, I would like to thank you all for your participation. Special thanks to Executive Director of CARPHA, Dr. St. John, Mr. Luis, Maia, and Dr. Barbosa for taking the time to advise us on this potentially life-saving matter. I must also say thank you to the members of the media for giving this briefing the importance that it deserves. We really appreciate it. Ladies and gentlemen, I thank you all. I wish you a good day and weekend. Remember to maintain your physical distance, remember to wear your masks, and remember to practice proper hand hygiene. All the best to you. Thank you so much.